Early removal of biflanged metal stents in the management of pancreatic walled-off necrosis, a prospective study. Introduction. The management of pancreatic walled-off necrosis, WAN, is currently in a state of flux owing to advances in technology. The advent of dedicated stents placed under endoscopic ultrasound (EUS) guidance, including the lumen-opposing metal stent (LAMS) and biflanged metal stent (BFMS), in the past few years has made it possible for the endoscopist to easily access the cyst cavity and perform endoscopic necrosectomy. The wide diameter of LAMS and BFMS allows repeated passage of the endoscope and accessories until the desired goal of cavity closure is achieved. Initial results with LAMS and BFMS for pancreatic WAN are promising, with an initial success rate of about 85% and complication rates of 15% to 21%. However, there are still unanswered questions, including how long the stent should be left in situ after placement, among others. A longer duration of stent placement may be associated with higher risk of adverse events such as bleeding, stent migration, and buried stent. The tendency for a longer duration of stent placement stems from the current evidence, which suggests that recurrence of pancreatic fluid collections, PFCs, may be higher, especially in patients with pancreatic duct leaks and the disconnected duct syndrome if the stent is removed early. There are no studies to show whether pancreatic duct leaks and disconnections play a role in recurrence following LAMS or BFMS placement. The authors conducted this study to evaluate the impact of 1. Early removal of BFMS, and 2. Additional stenting of the pancreatic duct with plastic stents on the risk of WAN recurrence. The authors also studied the rate of ductal leaks and disconnection in patients with pancreatic WAN and the accuracy of magnetic resonance cholangiopancreatography, MRCP, in diagnosing these conditions. Background and study aims. Dedicated stents placed under endoscopic ultrasound (EUS) guidance have shown promise for the management of pancreatic walled-off necrosis (WAN). A long duration of stent placement may increase the risk of adverse events. The authors prospectively evaluated the effects of 1. Early removal of biflanged metal stents (BFMSs) and 2. Additional stenting of the pancreatic duct with plastic stents in patients with ductal leaks on the risk of WAN recurrence. Patients and methods. Symptomatic patients with pancreatic WAN underwent EUS-guided BFMS placement, followed by necrosectomy when required from day 3. A 5 French plastic stent was placed in patients with ductal leak. BFMS was removed when the WAN cavity had collapsed completely. Patients were followed up at 3-month intervals. Results. BFMS placement was successful in all 88 patients. A total of 64 patients, 72.7%, underwent necrosectomy, median 3 sessions. All BFMSs were removed at a median of 3.5 weeks, range 3 to 17 weeks. Ductal disconnection and leak occurred in 53 of 87, 60.9%, and 61 of 87, 70.1% patients, respectively. A 5 French stent was placed in 56 of 61 patients, 91.8%, with ductal leak. Overall, 22 patients, 25.0%, had adverse events, 17 mild, 1 moderate, 3 severe, 1 fatal. Recurrence was noted in 8 of 88, 9.1%, at a median follow-up of 22 months. The recurrence rate was higher in patients with ductal disconnection than in those without, 13.2% versus 2.9%, p equals 0.08, and was similar in patients with versus without pancreatic duct stenting, 7.1% versus 12.9%, p equals 0.44. 7 recurrences, 87.5%, partially regressed on follow-up and did not require therapy. In 1 case, drainage with a plastic stent was performed. Conclusions. Short-term BFMS placement is an effective therapy for pancreatic WAN. The majority of recurrences developed in patients with ductal disconnection and did not require therapy. Additional pancreatic duct stents probably do not influence the recurrence rate.